Hello everyone. I want to welcome you to our question and answer session. And I want to thank everybody who sent in the questions. I was very much surprised by the response to that. And initially, in the early part of the week, I was getting a lot of questions about a procedure that people have been hearing about and reading about, a minimally invasive, usually office-based procedure for men who have non-cancer-related prostate disorders. It's called UroLift. But I have to say, in the last day, things have changed, and I've been getting a lot of questions about a news release that just occurred in the last day regarding our successful completion of a robotic bladder cancer removal. And because of the number of inquiries I've gotten about this, I'm just going to jump to that topic and discuss it now. And I'm going to read one question that I thought was humorous, but to the point. And it said, "Dr. Rock, tell us about the robot surgery." And I kind of like the sound of it, so I think we're going to name these sessions from now on Ask Doc Rock. But essentially, the question really and the answer revolves around utilizing what is referred to as robotic surgery to do all sorts of surgeries. Now, I think if you got on the internet, and we'll put some pictures on with this afterward, and look up robotic surgery, what you're going to see is that the new trend in doing surgeries is using minimally invasive approaches. Generally, this means utilizing scopes in one way or the other, and robotic surgery just takes this to the next level by utilizing a console-based system where we can have a robot hold and direct all of the instruments that we place, and it's almost like the surgeon is sitting at a video game and moving around the instruments. It's been absolutely fascinating. I'm proud to say that at this center we were early adopters of the technology, but it's become mainstream around the world. Those of us who use it routinely absolutely are convinced and have seen the amazing improvements in patient recovery and these days even surgical outcome by using this sort of technology. And like everything else, once you start successfully using technology in one realm, it just starts to generalize. Historically, what we see is that large centers or large academic centers are the places that most of the advanced surgeries are doing. And that makes sense. But the other thing that became very important to us is to make sure that when we offer any sort of procedure through our center here, that the outcomes and the quality measures are equivalent to those done outcomes in those other centers. So we made a commitment to try to make sure that the people that we bring on board in the center have the appropriate background to get us to that outcome. We were fortunate enough a couple years ago to be able to hire Dr. John Gunzelman out of Yale University, where he did a fellowship in robotic surgery and urologic oncology. Our hope was just to be able to make sure that our outcomes, which were always very good, could be considered outstanding. But what happens is concomitantly, as newer techniques for more sophisticated surgeries were being introduced around the world, it became apparent that we could offer the same thing. And this last surgery that we did, which was the complete removal of a bladder for bladder cancer and the reconstruction of a new bladder, was able to be done completely in the body without need of large incisions, which is how most places that have been trying to adopt this have been doing it. It's very technically difficult. We did it just out of desire to be able to offer this to our patients. What we didn't realize is that we were now offering techniques and technologies that have not yet been introduced throughout the entire state, which is why it's gotten so much publicity and why people are asking about it. A little bit then about the hospitals that we work out. We work out of tertiary level hospitals, but we also have affiliations with some of the smaller community hospitals. And what's happened, especially with some of these advanced technologies, is that around the country, some of the smaller hospitals have been faster to adopt these technologies, leaving some of the larger hospitals playing catch-up. And I won't go into the political details about it, but it always comes around the bottom line. And just by happenstance and great fortune, the smaller community-based hospital that we work out, Legacy Mount Hood Medical Center, has really fully committed to the robotic technology. In order to do the surgery that we did, it's not only imperative that we have the urologic reconstructive and cancer surgeons capable of doing it, which we ourselves can do, but we needed the help of surgeons who were particularly expert in the bowel surgery that is necessary for the reconstruction. And we are greatly fortunate to have Dr. Greg Starley, who practices out of the hospital. I always knew he was an expert surgeon. I always was impressed with his robotic surgical skills. What I've come to learn as we decided to take on this project was that he may be, if not certainly in the top 3 general surgeons in the state with the background and with the experience. He's actually one of the premier general surgeons going out training other surgeons in this thing. And it was just by the perfect storm where we had the urology surgeons with the appropriate background, and we're able to come together with the general surgeon, and we're able to do the surgery. What is the benefit? The benefit is remarkable postoperative healing. The bladder removal that has been traditionally done for bladder cancer is a very complex surgery, and it is very tough on the person's body during the healing process. It wasn't uncommon for people to be in the hospital for weeks after the surgery, for them to require blood transfusions, and for them to have multiple reoperations as a consequence of the complications. And what this has done, as what the robotic surgery has done for so many of the surgeries that we and general surgeons perform, is by not making us do the open surgery and expose the interior of an individual to the outside. The manipulation on the body, the trauma on the body is considerably less, and something that historically would take weeks to get a person out of the hospital or get them functional is something that we think about more in terms of days. People not in the hospital for 2 weeks, but in the hospital for 4, 5, 6, 7 days. We're very proud of the fact that we were able to introduce this. I look forward to pursuing this, as the interest seems to be something that is not going to wane. And I'm very happy to share this with you, and thank you for asking that question.